My name is Sean Delaney. I'm a board-certified facial plastic surgeon based out of Houston, Texas. Facial Plastic Surgery Associates was founded in the 80s by Dr. Russell Cradell, and for over 4.5 decades, it's really offered world-class facial plastic surgery, and ranging from rhinoplasty to facial rejuvenation surgery. I was a former fellow in 2017, and I've had the opportunity to take over the practice and introduce some newer techniques. So we're always improving and growing. And so as I joined in 2023, we had the opportunity to grow and increase our service lines. Most excitingly, as of last year, we have Dr. John Hamati join our practice.
I'm Dr. John Hamati here at Body by Hamati. I'm the breast and body specialist at Facial Plastic Surgery Associates in Houston, Texas. My focus is breast and body procedures like breast lifts, breast augmentations, tummy tucks, liposuction, basically anything you can think of that's below the collarbone. To me, FPSA is my home because I share the same values as they do, the same mindset as they do. I feel like I'm part of the FPSA family. We value our patients. We're a patient-centered practice. We take the time that every patient needs to make sure that they're happy, to get them to the point where they're comfortable and where they feel safe going through with a procedure that may not necessarily be the case at other practices.
When we consider somebody for facial plastic surgery, we think of whatever we're operating, whatever area, whether it's the lower face or the nose, in relation to the rest of the face. Now, someone may come in looking for specific changes, but it is our job as a facial plastic surgeon to make sure that those changes are harmonious with the rest of the facial features. There are obviously aesthetic standards that we try to shoot for. We just want to make sure that we create something that's elegant, that blends in with the rest of the face. And so this way, not only the patient gets what they want, but they also look natural afterwards.
A big part of helping a patient achieve their goals and their expectations is figuring out what exactly is it they want. There are patients that want an augmented look, that want more fullness, more cleavage in the upper pole, that want the top of their breast to look like they've had an implant placed, and that does not bother them, and it shouldn't bother anybody else either. Your goal is to figure out what they want and use your skills as a plastic surgeon, use the techniques that you've learned over time, your finesse, your cosmetic eye, and achieve that for them. And a lot of that comes down to technique, training, repetition. Having done procedures again and again, you ultimately are able to know how you can provide that result for a patient. And if they want the augmented look, they can have the augmented look. But if they want a more natural look, you alter your technique, you alter implant choice, where you're putting the implant to achieve that for them.
As a facial plastic surgeon, the results that make me the most excited honestly have nothing to do with how the surgery looked. It has everything to do with how the patient feels after the surgery. So what makes me the most excited is when we have a shy young girl who is very self-conscious about her nose, and afterwards you can see she blossoms, her confidence overflows. Or the mom who feels like as she's gotten older, people are starting to ignore her. They're looking past her. She's no longer important. And then she regains her glow after her surgery. So it's really beyond physical changes. It's about confidence and emotional changes that I see in my patients.
When a patient sees their result for the first time, it's really a joyous experience, an enlightening experience. As a surgeon, you're almost sitting there watching to make sure that they're as happy as you are with the result. But ultimately, if your patient's not happy, as a surgeon, you're not going to be happy. You could have done everything perfectly, and watching them go through that transformation, watching it sometimes even at the first, second appointment, you see that glint of confidence in their eyes, restoration of confidence, restoration of self-esteem that they have just from that procedure that they had a day ago, a week ago, 2 weeks ago. It helps validate the hours of training, of blood, sweat, and tears that you put in to do what you do. And it makes coming to work every day so much better.